If I come in and see you and say, hey, I need to be seen for this, what does that assessment look like?
Yeah, that's going to happen probably over the first 2 sessions. First one's really just going to be a clinical interview. So we look at history, we look at the dynamics of what's going on in their family, relationships, marriage, divorce, children, substances, looking at anything that is important to them, both good and not so good. So what are your strengths? What are your things that you want to really work on? That clinical interview is where that therapeutic rapport comes from. That alliance is extremely important, especially with first responders, where they know. Right?
They see that, they look for that personality.
And from what I understand, Dr. Kleis Hulbert told us that the greatest indicator of you sticking with treatment and it being effective is the rapport the patient has with the clinician.
That's exactly correct. Yeah.
Right.
Yep. And connection, right? So
just the human thing, right? That thing we can't put a temp gauge out there and measure the connection, the vibe. There's no vibe meter yet, right? But like that's a thing.
Sure.
Just the human thing.
Yeah. And that's just it. It's the idea of what's called a tumen, right? How do you kind of connect to each other? And for a therapeutic alliance, for the therapist and patient connection, it has to be also like an emotional connection, right? So that's where change actually really happens. And it's not necessarily something that most therapists would say or do, right? It would be, we're doing cognitive behavioral therapy, CBT. This is going to be manualized. This is evidence-based. We're going to do it in this way. That doesn't really work for people who don't want to deal with BS, right? They don't want to
people that don't.
I just want to get in there. I want to see what this is about, and let's get it done.
Yeah.
Right. I'm a talker, so CBT's been my thing. Like, so if you like to just get after with a conversation, I'm your candidate. But I could see people that are so inward that don't have that button, that part of their brain that likes to just communicate through words. I could see how that would be rate limiting for them for CBT.
Yep. And not knocking it at all. CBT is fantastic. Can really be great for some, but they also have to get to another side of that because that's just really your cortex, your how you're kind of thinking, with executive function. So if I do A plus B, I get C. But a lot of these being more trauma-related, trauma-focused, it's a basis of that is not where you start. This is not a top-down process. This is a bottom-up process. So the idea of kind of what the body, the somatic, the physiological kind of sensory stuff that needs to be out, right? That needs to be processed, reprocessed actually, and then desensitized. So in that way, it's very different, right? So that emotional connection allows that bonding, which then allows you to get some of that work done because now hopefully you have the rapport that involves that trust that's necessary to do this work.
Now we can get the work done.
Exactly.
You kind of hear that phrase sometimes in these settings. This is where the real work happens.